Greetings on behalf of your entire financial team. Tim Kimmel, Adam Jordan, and myself, we're thrilled to have you here. And welcome to all of you. This is a very timely topic, session on Medicare, and it's a very timely time to do this as well. Well, we've got registered to attend over 200 clients in 9 states. So we're thrilled to have you all here. Our goal for these sessions is to provide timely insights on planning, retirement, education, and investment topics of interest to you, our clients. So again, we're thrilled to have you here. This is a key part of our exclusive peak planning process. Now, all of you that are clients of Ried Financial Group are part of that process. P, planning, education, advice, and consulting. Planning, for example, most of you have been through a process where we begin that retirement journey, where we looked at when can you retire, how long we have money last, what kind of return we need, and built a strategy and an approach to carry you all the way through retirement. Then we think about education. Education is during our planning sessions, but it's also through sessions like this. This is our virtual client education series, which we rolled out several years ago, and it is specifically focused on topics of interest that we believe would be appropriate for you and the rest of our clients. And then I also think about the advice area and advice on particular topics as you reach certain areas of planning. For example, Social Security, Medicare, required minimum distribution. So it's really advice on these key decision points relative to the plan and taking advantage of the experience we've had over the last 3 decades. And then I think about that last portion, PEAC, planning, education, advice, and consulting. And that consulting is generally one-on-one consulting. And those are particular issues. It could be caring for an elderly parent. It could be, I had one client, for example, that said, I want to help my daughter and son-in-law with a down payment on a house. How do we do that? Do we take a loan out? Do we take money of our portfolio? What are the tax implications? So it's really pinpoint advice on whether it's a state transition, whether it's a family financial meeting, or whether it's a particular need or opportunity specific to each client. So we're thrilled to do that. And we think you'll find this topic particularly important at this time during the Medicare enrollment period. Well, this session is going to be recorded for those that are unable to join, and feel free to pass this on to family members or associates or friends that might have an interest. Well, now I'd like to turn it over to Tim Kimmel, our Chief Financial Advisor, who'll be our host for today.
Hey, thank you, Paul, so much. I appreciate that. And welcome, everybody. I really appreciate you taking time out of your morning to spend with us on this very important topic. Like Paul mentioned, Medicare, it's so complex. There's so many elements to it. Obviously, lots of different plans, lots of changes going on this year. So as Paul mentioned, very timely event. And as many of you know, we are in the open enrollment period as we speak. Open enrollment, I believe, started October 15th. It runs through December 7th. So again, very timely, and hopefully we'll have some information and share some interesting facts about what's going on within the Medicare system, and really help you and be a resource for you to make the best decisions for you and your family, of course. As Paul mentioned, our peak suite of services, very important. As you know, one of those goals that we have with these peak suite of services is really to communicate with you on various topics and in various ways, of course, right? We do our personal planning meetings with each of you. Those are important, of course. Also, we do our event up at Newcastle Live every year. That's also an event where we have a guest speaker come in and talk really more about the economy, what's going on in the world, how that's applicable, obviously, to you and your financial picture. And then also we do occasionally these market letters that are important that Adam and his group put out that are timely. So those generally go out 2 or 3 times a year. And in these type of sessions, we call these educational series of sessions, and really on various topics of interest that are really pertinent to you in the planning process, but also in your retirement journey. So very, very happy, again, like I said, to bring this event. And obviously, like I said, we're excited to introduce our speaker. But before I do that, a couple of things. We have all of our events, as Paul mentioned, recorded. That can be found on our website. We have the library or of all of our events. that can be found under paulried.com in the Insights tab under the video section. So you can see a whole library of all of our past events. Those events include things like Social Security, kind of wading through Social Security decision, taking it early waiting. Things like legislation that affects your retirement, like the Secure Act. We did an event on that. Another event that we did was on online security, which was probably our most popular attended event, and how to protect yourself online and your online presence. We did our last event on estate planning, the 5 questions everybody should have answered to their estate process here. And so those can all be found again on our website. So I encourage you to take a look at those for those of you that weren't able to attend those. They're a great resource and a great place for you to go and even refer family, friends, colleagues that maybe didn't have a chance to participate in those as well. So these events really, again, are for you. Our goal is to make it fun, but also educational, and really bring these important topics to bear, really, which can be a springboard to our conversations personally in our planning sessions, or obviously questions for you to search out on your own. As I mentioned, trying to help you have the best information so you can make the best informed decision for you and your financial picture. But again, before I get to Tim, our guest speaker here, a few logistics I want to go through. So there's going to be, we're going to go about an hour, 60 minutes of time. It's going to be about 30-40 minutes of prepared content that Tim will share on various aspects of Medicare and the changes and the different types of plans that are out there. There will be an opportunity for Q&A. That's usually 20 to 30 minutes. And we may not be able to get to all of your questions. So again, we'll try our best to get to as many of them as we can. If by chance we can't get to all those questions, somebody on our team or on Tim's team will reach out to you, and we'll be sure that those are addressed, of course. The other logistic piece is how to ask a question. And I will be collecting those questions throughout the session, and then during our dedicated time, I'll be asking Tim specifically these questions that you pose. But if you scroll across your screen, you'll see a Q&A tab at the bottom, and you just click on that, type in your question, and then those questions will populate into the Q&A tab that I'll see. And then again, at the appropriate time, we'll turn to our Q&A time, and I'll address those questions. And like I said, we'll try to get to as many of them as we possibly can. So with those administrative things out of the way, let me introduce Tim Mickelson, our guest speaker. Tim is a licensed insurance agent for Medicare Compare USA. He is an independent insurance broker as well, so he's not tied to specific products or company, types of plans. He has helped folks understand Medicare and wade through the complexities since 2012. And he and his partner, Louise, have had over 20 years of combined experience in this Medicare world, if you will. Tim is licensed in various states. He's here in Washington, of course, Oregon, Arizona, New Mexico, and Colorado. So again, resource obviously not just for us here in Washington, but for folks listening across the different states that are tuning in. Tim is a graduate of Colorado State University, lived in Minnesota for 10 years after that, and then moved here to Seattle in 2006. Tim, from my personal experience, I know this for a fact, he focuses on doing the right thing, providing information and education, again, to help people make informed, equipped decisions. And he does put your interest ahead of his own. And that has been demonstrated time and time again with the feedback that we've gotten from folks that have worked with him. So with that said, let me introduce you to Tim Mickelson. And Tim, thank you so much for joining us. And I'll turn it over to you.
Thank you. Wonderful introduction. I appreciate that. Yeah, so let me pull up the presentation here. Okay, I think we've got it up there. All right, so this is a more Medicare orientation, where it's going to be an educational seminar for those preparing for Medicare eligibility. And just talking a little bit about who I am. I think Tim did a great job. I'm a broker for Medicare. That's all that I focus on. And we got the different parts, Medicare A, B, C, and D. And I'm going to get into great detail about that today. And of course, answer any questions that people might have. And then after the seminar, if you do have questions about Medicare and I can be of assistance, we'll definitely be able to share my contact information, my email, and my phone number. All right. Well, let's get started with original Medicare. All right. So Medicare A and B, there's always some confusion about this, but the reality is that A and B is offered by the government, and A and B is going to be the base of your insurance coverage once you're on Medicare. And that is either when you turn 65 or if you have retired beyond age 65, and in some cases, folks that have disability. So there are people who go on disability, and on their 25th month of Social Security disability, they are actually signed up automatically for Medicare. And that's kind of unsettling because they don't really know, as most of us are turning 65, we know that we're supposed to be looking into this. And of course, in some cases, we're automatically signed up and we're talking with friends about it. So we kind of have it on our radar. So unfortunately, a lot of those folks on disability weren't really expecting it and not sure what to do. So yeah, definitely pass them on to a resource like myself. All right, so Medicare Part A, that is actually our hospital coverage. And Medicare Part B is the medical coverage. And I'll get into more detail about that here in a bit. But with Medicare Part A, there is no charge for that, for most of us anyways. As long as we've worked in this country, we've paid those taxes, the Medicare, Social Security taxes, you can obviously see those coming out of your paycheck. As long as you've done that for 40 quarters or a combination of 10 years, you are eligible for premium-free Medicare Part A. Now, that does, of course, there's some people who move here and, maybe they work a little bit, but maybe they don't earn all that time and paying those taxes. Well, those folks could have to pay up to $499 per month for Part A, although they would still be eligible. It would cost quite a bit. So that's really the benefit that we're getting back in the form of, our Medicare Part A benefits for, no additional dollars. Now, Medicare Part B, the medical coverage, that does have a premium. And at least the base premium for this year is $174.70 per month. What's interesting is if you are collecting Social Security, you would automatically have that Part B premium deducted from your Social Security payment each month. If you're not collecting Social Security at the time, many people don't, they want to delay that. Well, then you'll actually be billed directly, and Social Security will actually collect that money from you, usually on a quarterly basis, but you can also set it up as an auto draft from a bank account. It really is whatever you prefer. All right, and the two of those together are called original Medicare. And when you have A and B together, you basically have a health insurance plan minus drug coverage. So the government insurance A and B is the base of the coverage, and that will provide you with a substantial amount of benefit. And we'll talk about that. But there's also the question is about what about Part C and Part D? And I will get to that, but those are private health insurance plans that have a contract with the federal government. So you're working with a private carrier, but they are following very strict guidelines set out by the government. Okay, now in some cases, well, let me jump to the next page here. Signing up for Medicare. So like I said, if you are, well, I actually didn't say this yet. If you are collecting Social Security the year that you turn 65, you will automatically be signed up for Medicare Part A and B. And that card usually arrives about 3 months prior to the first of your birth month. Now, the effective date of that card will be the first of your 65th birth month, or if your birthday is on the first of the month, it'll go back to the first of the previous month. So that can get a little confusing too. I guess my big warning to people is that if you are collecting Social Security and you're getting into, let's say, even just 3+ months towards your birth month, really keep an eye on the mail. A lot of us are just getting swamped with all this marketing and we're throwing it in the trash or recycling it. And I've had people get their Medicare card and throw it away, not realizing that that was a legitimate card that they needed to keep. And it is paper, so a lot of people will assume that it's just marketing. But yeah, your Medicare card comes, it's kind of a red, white, and blue coloring to it, and it is paper, but you'll be able to tell that it's legit. It's got your full name on it. And then the Medicare number is a series of numbers and letters. And then it'll actually below that show your Part A effective date and Part B effective date, which, like I said, should be the first of the month of your 65th birth month. So it doesn't matter if you were born on the 29th, your coverage will start on the 1st. All right. And if you're not collecting Social Security, yet you do want to start your Medicare benefits, you would have to basically go into Social Security, so ssa.gov. And if you look at the top of the screen, there's a drop down that says Medicare, and you just click on and enroll in Medicare. And that'll take you through a process where basically you're just answering questions and hitting next. At some point, you'll sign into Medicare, into the Social Security account. And at that point, you'll continue on with your Medicare application. Now, you have a couple of choices there because there's going to be some questions that they ask. That's number one is, are you currently on a group health plan? And what they're asking is, do you have employer coverage? Well, if you do have employer coverage, you have the option to say, well, I don't want to get onto Part B and pay that Part B premium. So what a lot of people will do if they're still working and they're 65 is they'll sign up for Part A, which is premium free. They'll have sort of a little bit of a double coverage there, at least for hospitalization. And then they'll defer their Part B. And that's really the only situation where it would be okay to defer that Part B. If you don't have that coverage through your employer, let's say or maybe you have COBRA, or maybe you want to continue on with your Affordable Care Act plan, you can do those, but you actually would start to get a late enrollment penalty for not signing up for Part B when you first became eligible. So an actual employer plan where you are an active employee is really the only situation where you can continue to be on the employer plan and defer the Part B, not pay that Part B premium. Same thing with Part D, which is the drug coverage. If you don't sign up when you're first eligible, you will incur a late enrollment penalty, 1% per month until you do sign up for that. And once again, if you have an employer plan, then you don't have to sign up for the drug plan until after you retire or lose that employer coverage. All right. All right, so let's talk about these parts. What do they actually do? Like I said, I think that this is pretty good coverage. Medicare Part A obviously is primarily geared towards covering hospitalization. Now, of course, I'll tell you, this is 2024 numbers. We haven't gotten the new numbers for 2025 yet. I would imagine that they will be incrementally a little bit higher than this. Not too bad, but they do seem to raise the copays and coinsurance and deductibles a little bit each year. All right, so under Part A, if you're hospitalized, Medicare is going to cover your hospital expenses at 100% for the first 60 days once you've met the $1,632 deductible. So that's pretty good coverage. I mean, even one night in the hospital could be $10,000+ So if you can imagine having a stay where you got a $250,000 charge, you're only going to be responsible for paying $1,632. So where it can get a little scary is if a person needed care that went greater than 60 days. So days 61 through 90, you would have to pay a $408 per day copay. And if you were in there longer than that, days 91 through 150, well, you'd be burning your 60 lifetime reserve days, and you would have to pay $816 per day. Well, that is not the scariest thing. Yeah, I know that's a lot of money, but the scariest thing is that now past 150 days, you have no coverage. At that point, you are paying 100% out of pocket for that hospital stay. And I think we know that that can really do damage to someone's nest egg. So I'm going to tell you, don't worry about it, because that's why we're here to talk about what those other options are. And that could be a supplement, that could be Part C. These are the things that are going to step in and really protect us from having really high costs for medical care. And of course, most of us are not going to need a long stay in a hospital. It's more likely that we're in there for a day or two. And then if you are in the hospital long enough, at least 3 days, and you have significant needs as you get discharged, a lot of people will go to a skilled nursing facility. And in a skilled nursing facility, they're going to cover you for your skilled or rehabilitative care. And they'll cover you at 100% for the first 20 days. Now, that is provided that you are participating in the programs that they have you going through. Obviously, there's a lot of rehab and stuff like that. But provided you're doing that, showing improvement, they will cover the first 20 days 100%. Some people need more care than that. They will still cover you up to 100 days, but it would be at a $204 copay per day. There is no coverage beyond 100 days. Medicare basically would consider you chronically ill, and they just don't cover anything beyond that. Some people are actually able to go home, and when I say home care, this is where somebody maybe is not able to safely leave their home to go in and get care. And in that case, then they can send the care to you. They can have a physical therapist come to your home. They could have a doctor or nurse come check up on you or do wound care, things like that. So in that case, obviously they're not paying high cost facility fees, so they do cover that at 100%. What they're of course not going to cover is, things like having you meals prepared for you, or getting you dressed or showered and things like that. All right. And then also hospice care is covered. And I say generally it's about 100%, but here it says 95%. Hospice is when you are diagnosed as having less than 6 months to live. And in that case, then, most of that care is covered. Of course, the person would stop receiving the treatments for whatever is ailing them, and then they would go into what they call comfort care. And they have these hospice nurses who are just fantastic and do a really good job. All right, so let's talk about Medicare Part B. This is what we traditionally or will be using more often than the Part A, hopefully. And with Medicare Part B, it's going to cover those medical expenses with your physician. So that could be outpatient surgeries, could be emergency room, could be just seeing a specialist. There's durable medical equipment that people need, physical speech therapy, diagnostic tests. There's all sorts of things that we would need through our physician services. And that's where Medicare Part B steps in. And you can see here, I mentioned that there's $174.70 base monthly premium for that. Some people are listening to this and saying, that's not what I pay. I pay a much higher amount. Well, depending on your income, you could be at a higher cost, and that's what they call an income adjustment to your plan, to your Medicare Part B. And that would not only cover, increase the cost of your Medicare Part B, but it also adds an extra charge to the Part D coverage that you pick up as well. But anyways, for most of us, we're going to be looking at that base Part B premium, and that's $174.70 per month. When you first receive Medicare Part B services, either when you first become eligible or, calendar year, you'll be responsible for the Part B deductible. This year, it's $240. That's not bad. I've got some people that are, coming into Medicare, and they've got $8,000 or $10,000 deductibles. And, it's to the point where you may never actually hit the deductible and actually get any coverage. But with this, it's pretty generous. You have a very small deductible. You pay 100% of your expenses until you reach the $240. Once you've done that, Medicare will step in and cover 80% of your expenses, and you'll be responsible for the other 20%. So pretty good. And of course, the $240 deductible would not count towards preventative services like your wellness check or mammograms, colorectal exams, things like that. So those things would be at zero cost. Okay, well, that sounds great. That's wonderful insurance, right? So that's all we need. Well, no. If you look at the last bullet point there, you'll notice that Medicare A and B does not have a max out of pocket. So yeah, we've got these hospital deductibles. We've got, per day charges if we're in a skilled nursing facility. We've got the deductible in the 20% that we'd have to pay under Part B. So if, most people, I think in a normal year, probably doesn't matter. But if at one point you did have a significant change in health, had a cancer diagnosis or, just chronic illness where you're just constantly needing doctor services, labs, MRIs and being hospitalized all the time, you could see that, you'd be potentially be paying 10, 20, $50,000 out of pocket in a given year. So we need to have that net. We need to have something that basically says, no, if you have a bad year, you're only going to pay so much and then that's it. We're going to protect you for the rest of the year. And that's what we're going to discuss. That's going to be the supplement or the advantage plan. Both of those products will provide you with that max out of pocket protection. So you can't go wrong, whichever one you choose. Medicare itself also just, like we said, we've got the deductibles and co-insurance. We've got prescription drug coverage, which is not covered under A and B. We'll find that as a separate plan. There is no dental coverage under Medicare A and B, and there's no routine eye exam or eyewear. With that said, I will say that, people's bigger concerns are, well, what if I have a cataract surgery, or what if I need some medical help for my eyes? And that of course is considered medically necessary. So that is covered under Medicare A and B. There is no routine hearing or hearing aid benefit under Medicare. So that's something we also have to consider here. Okay, well, here we go. Yeah, we got two paths to choose. So let's get into the meat of this, right? You can choose one side or the other. You can't be on both sides at the same time. So only one side at a time can be active. And that is, on the left side, we have this opportunity to sign up. Well, we'll have Medicare A and B. We'll have an opportunity to sign up for Part D plan, prescription drug coverage, what they call a standalone prescription drug plan. And then also sign up for a Medigap, or what we also know as a Medicare supplement plan. And of course, the names of this is very important, but what a Medigap does, and there's a lot of different ones to choose from. They actually have plans A through N. So these are letters. Now, don't get it confused with parts A, B, and C, D. Those are parts, and those are government. The Medigap supplement are plans, and they're actually private insurance plans that are regulated by the state. So you've got, like I said, plans A through N, and not all those plans are even still available. The government has actually removed like 4 of those. And then there's even some restrictions on a couple. Plans C and F are only available to folks who turned 65 or became eligible for Medicare prior to January 1st of 2020. Since then, people who want that higher end coverage have been gravitating towards what they call Plan G. So it's a very similar plan. But there's also other very popular plans, and these are offered by private insurance companies, and they get to kind of choose which ones they want to offer. So they don't offer all the A through N plans. They may have 4, 5, or 6 plans that they offer. So, and then because those supplements, and I'll say, regardless of what supplement you choose, from the lowest cost one to the highest cost one, you're going to have max out-of-pocket protection. It's also going to protect you from losing that Medicare Part A hospital coverage, where you have the large co-pays and then you run out after 150 days. The Medicare supplement plans will provide coverage up to 365 days. So in most cases, with most of the plans that people choose, there could be 0 cost from day one all the way to the 365th day. All right, and those plans do not cover drugs, so we do have to purchase a standalone prescription drug plan, and that could be an additional premium. And then that would cover our outpatient prescription medications that we get at the pharmacy or through a mail order program. All right, so that is one option. The other option on the right side is the Medicare Advantage plan. This is what they call Medicare Part C. And a Medicare Part C plan, I've heard many times, is referred to as having A and B and Part D all in one package. So it's all bundled into one card. Now, of course, these Medicare Advantage plans are private health insurance companies that have a contract with the federal government. And what these plans do is they don't replace Medicare A and B, but what they end up doing is they provide your medical care to you instead of Medicare A and B. And, what's interesting is that because they have that contract with the federal government, none of your bills while you're on an Advantage plan will go back to Medicare A and B. And the reason for that is that Medicare A and B, or the government, sends a capitated amount to the Medicare Part C plan on your behalf. So part of that is that Part B premium that you're paying, but it's also a big chunk of additional money that they send to them. And what's really neat about the Part C plans is they can provide additional benefits that we can't necessarily get through Medicare, the left side. So first of all, the contract that these private insurance companies sign says that they have to provide benefits that are as good as Medicare A and B. Now, they can be better, and oftentimes they are, but they have to at least meet those minimum standards. They have to cover the same services that Medicare A and B covers. They have to cover it at roughly the same cost share with the amount that you have to pay for various things like hospitalizations and surgeries and MRIs and CAT scans. But they also can provide things, additional ancillary benefits like dental coverage or routine vision or hearing aid benefit. Some provide coverage for chiropractic, acupuncture, and naturopathic medicine. Some can provide athletic club memberships or an over-the-counter benefit, meaning that you can get over-the-counter items like vitamins and baby aspirin and Band-Aids. So these are kind of neat, but there really is the right plan for the person based on their needs. And that's something that I help people to figure out. So there's a lot of different times that we can make changes or add coverage and things. Right now, we're in the middle of what they call the annual enrollment period. And the annual enrollment period runs from October 15th through December 7th. And for people who are already on Medicare, who already have a plan, this gives them an opportunity to sign up for a different plan, change, or even just review their existing coverage just to ensure that they're on the right plan. So I've got people who call me up and they say, well, I've got this prescription drug plan. I'm not sure if it's the best one for me next year. And what I'm able to do is to take their medications and their dosages and where they get the meds and figure out, what plan next year will be at a lower cost, or is it the one that they're on? So we can make changes anytime up to December 7th. Any change we make during that period is going to take effect on January 1. And you can make as many changes during the annual enrollment period as you want, but the last change that you make is the one that will take effect the following year. Okay, so there's other opportunities to get into these plans, of course, too. When a person first turns 65, they have their initial enrollment period, and that's where they can really just, from this slide, you can choose either side. You can go with A and B and add your drug coverage and a Medigap supplement plan from any carrier, and that would be guaranteed issue. Beyond its first 6 months of your Part B eligibility, you may not be able to get back into a supplement because beyond that guaranteed issue period, the supplement carriers can ask health questions and easily just say, well, we're not interested in taking on that risk and decline you for the coverage. So that is something to consider when looking at these two different options, is that, you can always go to Medicare Part C. You can always switch between Part C to Part C. You can always go from a supplement on Medicare A and B to Part C, but it could be more difficult getting back. So these are things to consider. Let's see, there's also what they call special enrollment periods. And some of these are if somebody were to be hospitalized or put into, or gone into a nursing home. They could move from one state to the other or one even different county And if they go to another county and their plan is not available, whether it be the prescription drug plan or a Part C plan, they might have to make a change, and then they do. They have a 63-day window in which to make that change, and there's no issues with that. You know, when we look at these different plans too, a lot of people say, well, wait a minute, I don't understand, where does my Boeing plan fit into this? And it could be Boeing, it could be a PEB, it could be a state employee who's using insurance coverage that was provided by their employer. That works in concert with Medicare. Some of them are actually kind of, I guess, a hybrid of the left side, where they're using a supplement and drug coverage, and others are using the Medicare Advantage. I know that's the big plan right now with Boeing, is not allowed to say the name, but everybody here knows who it is. And that provides them with Medicare Advantage coverage. So that kind of where it falls. But, you know, the Boeing used to have the Medicare supplement plan that they used with standalone drug coverage. And as of 2024, they switched it over to the Part C plan. You get some calls from people who are worried about that and say, oh, well, I heard that if you're on an advanced plan, you could never go back to a supplement plan. Well, this is the one exception. The Boeing plan or any other plan, like I said, PEB or state government benefits, if you're on an employer-based Medicare plan and you decide you want to leave that plan, usually that means you're leaving for good. They're not usually going to let you come back. But that does give you a one-time opportunity to choose really anything you want. It's almost like your initial enrollment period. So you do actually have the ability to jump onto any Medicare supplement plan, and that would be on a guaranteed issue basis. So I always tell people, you know, if you're concerned about this Advantage plan, try it out. Try it out. You can actually leave any month that you want. So if you're on for 3, 4, 5 months and you say, oh, this is not working out, you know, you can contact me and I can help you. But I always think it's best to try the plan out. Usually these employers are giving you pretty good benefits. Not always. It's not always been the case, but it seems like it's pretty good right now. Okay. I'm going to just cover one more thing. There's so much to talk about when it comes to Medicare, so we could spend hours and hours on the phone or on the webinar here talking about it. But there is an interesting change next year I would like to take you to. That is it. All right, so many of you are probably familiar or have heard of the donut hole or the coverage gap. And that's that mean, nasty thing that happens to some people who have higher cost medications. Well, it actually was not that bad in the most recent years. When the coverage gap started, gosh, I want to say it was probably 2010. People were covered for a certain period of time under regular co-pays and co-insurance, and then once they hit the coverage gap, they had to pay like 85% of the cost of the medication. Well, if you can imagine, you had a really expensive medication that could, you know, be pretty rough. Over the years, that amount that a person's responsible for has reduced and reduced and reduced, and it's been about 3 or 4 years now where once a person hits that coverage stage, they have to pay 25% of the cost of their medication. So that's better, but yeah, there's still people who, even up through last year, were paying $3,000-$4,000, you know, out of pocket for their medications, and that's a lot of money for someone to deal with. And in addition to, you know, paying premiums for Part B and supplements and things like that. So, as of 2025, pretty good news here. Nobody will have to pay more than $2,000 over the course of the year for their medications. Now, there's some caveats to that. Of course, the medication has to be on the formulary. It means it has to be covered by the insurance company. They have to say, okay, well, we cover medication ABC, but we don't cover XYZ. So if you're taking XYZ, you might have to look at changing either the plan or changing the medication. And often cases, there's an equivalent medication that your doctor will sign off on. But at any rate, if you're taking medications that are all on formulary, you're going to be limited to $2,000 for the entire year as far as your out-of-pocket costs for medications. Now, that is separate from the health plan. So if you do have a max out-of-pocket on your supplement or your Medicare Advantage plan, that's not going to apply. That's going to work in a separate way. Let's see here. Yeah, so that's good news. And I'm actually, as I'm running these drug analysis this year, I'm finding that people who were paying, in some cases, $3,000-$4,000 last year may not even be asked to pay the full $2,000. So there's an internal work in there that does calculation, and some people may, they may end up be asking to pay $1,500, not $2,000. So it's pretty exciting. It's pretty exciting that this is happening. Okay, and then the one other thing about the new plan is that a lot of people who do have these high-cost medications are being asked to pay $600, $800, $1,200 in January. And then it's another, maybe $600 in February. And then by, March, April, May, it starts to go down a little bit. That's still the case with some of these plans, but next year you can actually contact the drug provider, the drug company, the insurance company, and have them spread your cost out over the year. So if you've got to pay $2,000 over the course of the year, you can actually have that spread out into equal payment amounts so that you would actually pay the insurance company, not to the pharmacist themselves. So you'd actually pick up the meds for no cost from the pharmacist, and then you'd be responsible for paying. So anyone who's interested in that, who's concerned about the high cost, like in the earlier part of the year, contact your insurance company and ask them how that you can get signed up for that benefit. That can happen ahead of time, or it can happen anytime during the year. All right. Okay, and just one last thing. The Medicare prescription drug plans and the Part C Advantage plans all have a star rating. And the star ratings can be anywhere from 1 star to 5 stars, 1 being poor, 2 below average. And then where I'm seeing most of the plans following the line is either the 3, 3.5, 4, 4.5 stars. 5 stars is pretty rough. It's pretty tough to get. And we don't see too many carriers out there that hit the 5-star rating. But yeah, most are going to be kind of fall in between that 3 and 4 star rating. But if you're interested in that, you can go to Medicare.gov, find the plan, see what the star rating is, and it'll give you a whole list of information on how they received that star rating, what were the factors that went into it, where did they do well, where did they do poor. All right. And I think we got everything there. So I want to thank everyone for allowing me to tell you about Medicare. I certainly enjoy talking about my trade. And with that, I'll give it back to Tim.
Hey, thank you, Tim. Great job. Appreciate the information. I know there's a lot to unpack with Medicare, so many facets of it. I know we're just hitting the surface, unfortunately, with the time that we have, but we do have a number of questions. So I'm going to kind of quickly go to the questions here. One of the questions that came in, Tim, is to kind of address some of the disadvantages that you see of an Advantage Part C plan, if you will. There's some concern about a private in organization, right? Maybe having, difficulty getting second opinions or a secondary primary care approval if needed for various surgeries or procedures. What has your experience been on that, and other kind of disadvantages to the Advantage option that you see, if any?
Yeah, I think, with the Medicare Advantage plan, there are certain situations where they will require pre-authorizations for certain tests like MRIs, CAT scans, or, just require more information before they'll allow it. As far as, declining to do a surgery or something like that, Medicare does the same thing. Some people have found that having Medicare A and B, using that, and then along with a supplement, does provide them a little more flexibility. Obviously, they're going to pay more money. It's quite a bit more money to have that supplement anyways, but it can provide more flexibility as far as bouncing around between different doctor's offices, or if you wanted to receive care out of state, you could have some more flexibility there. With the Advantage plans, and this is kind of, they vary across the country, but certainly in Washington State and Arizona anyways, you've got the primary plans out there are PPOs and HMOs. Now, these plans do have networks of physicians, but what normally happens is, when you're an employer plan, it usually is a PPO because not every plan provider is going to be a network. So you got to have the ability to use an in or out of network provider. Of course, if you go out of network, you're going to pay a higher amount. But in the Medicare world, we can actually say, okay, who are your doctors? What are the meds that you take? And find the HMO or PPO plan that has all your doctors in network. And that obviously means that you're going to pay the lowest cost for that. So yeah, there is a network with Advantage plans. There is no network with Medicare. Medicare, you can use anywhere in the country as long as the doctor or the hospital accepts Medicare as a form of payment. And that's still most of them.
Yeah, follow-up question then would be, what if I'm on an Advantage plan and I'm out of network or I'm on a trip or something and maybe the doctors that are approved under that network are not available to me? How does that function?
Yeah, that's a great question. So with the Medicare Advantage plans, all of them have worldwide emergency and urgent care coverage. And that even includes ambulance in most cases. So if you're in Spain and you injure yourself, you're going to be able to see a doctor and it will be covered. Generally, what you got to do, of course, is pay that up front, bring the bill home and get reimbursed for it. But certainly if you're traveling around the United States and, you get pneumonia or you break a leg or you injure your arm or you're just not feeling well, you can get medical care and it is covered because there is no network, quote unquote, when it comes to emergency or urgent care.
Great. Good. Very good. Another question from Mark. It says, I'm a Boeing retiree utilizing the Boeing Medicare supplemental plan through Aetna to maintain my spouse on the Boeing medical when she turns 65. Is the Boeing Medicare supplemental through Aetna available to her as well?
As I understand it. Now, this is definitely something that you want to check with the Boeing benefits administrator. I don't represent that plan, but I do know enough about it that I do kind of help advise people. And then, of course, finish off by saying call them and verify that. But yeah, my understanding is that especially those spouses who are not yet 65, they have that fantastic Boeing coverage, the retiree coverage, and they'll always receive a letter stating that, we know when your Medicare starts. So let's say your June 25th is your birthday. You're done after the end of May, we're cutting you off. Well, then that's the opportunity for them to then take that next step and sign up for the Medicare plan through Boeing that will start on June 1. So of course, they have no lapsing coverage. They're just moving from one Boeing plan to another.
Great. Another question from Therese. It says, do you as a broker have access to all available Medicare plans, traditional as well as Advantage plans? And then two, is there more cost to use somebody like you that can help somebody wade through the options versus going direct?
Right. There's no cost. Agents should never be charging you, a Medicare agent anyway, should never be charging you any fees. We got it set up where if we help you with a plan and we submit that plan to the insurance company then pays us a commission. So there's never a charge to you. As far as what plans do I cover, I cover, I want to say most of the plans. I don't cover all of them. I cover the ones that I know, especially with the hospital systems, I tend to work with the most, and the doctors that are going to kind of create the biggest bang for the buck. If I see that there's something that I don't have that is probably better for the individual, I would tell them that. But that doesn't really happen too often. There's not many plans that I don't represent. But I will admit, I don't represent 100% of them.
Yeah. And then Debbie asked, year to year, can you change from Part D to, and Medigap plans to C? If you're, again, not an open enrollment, I guess, what are the mechanics of changing from traditional Medicare, so to speak, to Advantage and vice versa?
Yeah, and most of that is going to happen during the annual enrollment period. So if you're already on a plan, let's say you're on a Medicare supplement and a standalone prescription drug plan, during the annual enrollment period, you can switch to a Medicare Advantage plan. There's no, basically it's just filling out the paperwork. I say paperwork, everything's not electronic, but, initiate an enrollment into a Medicare Advantage plan, that would actually automatically cancel the prescription drug plan that you're on. Of course, not until the end of the year. Nothing gets canceled immediately, but that coverage would go to the end of the year, and then the Medicare Advantage plan would start at the beginning of the year. You would actually have to call into the supplement company and cancel that supplement. That doesn't happen automatically. But yeah, there's never any issues with moving to an Advantage plan or from an Advantage plan to an Advantage plan. There is no pre-existing conditions. There's nothing that they would deny you for. And you have, as of January 1, the start of the plan, you have the full benefits in the plan. There's no waiting period or anything like that. It can be more difficult though, like I said, if you're on an Advantage plan and down the road you decide you want to switch back to original Medicare, get a prescription drug plan, no problem. But if you want to sign up for a supplement plan, they may ask health questions unless you have a guaranteed option to move back to a supplement.
Great. And again, Vincent follows up with, so can you switch any time plans, or do you have to wait till open enrollment?
Yeah, there are special enrollment periods, like I said. So, for instance, someone's retiring in June, right? They have an opportunity then to go and get, well, really any plan, but that would be a special enrollment period. Somebody moves in August to another state or something, that becomes a special enrollment period. So for the most part, if we're already on a plan, we don't have any of these special enrollment things that come up, we would be doing it just between October 15th and December 7th. Now, there is an additional one that if people are on a Medicare Advantage plan, and let's say they didn't look and found out their doctor doesn't cover it next year, they find that out in January. There is a thing called the open enrollment period, which is not advertised. It's not like right now where you see constant Medicare stuff on the TV. That is, of course, after the political ads. And but the OEP gives a person on a Medicare Advantage plan a one-time opportunity to switch to a different plan either in January, February, or March. Once we get past that, then you're pretty much on that plan for the rest of that calendar year, but have an opportunity, of course, then again to switch during the annual enrollment period.
Great. We got another question from Sue, says, what does the enhanced PPO mean on my insurance card?
Enhanced PPO, that would be a company specific thing. It could be an enhanced benefit for dental. It could be an enhanced benefit for over-the-counter benefits. Yeah, it could be a number of things. I could certainly look at that individually and give you an answer to that.
Okay. Tricia asks, I'm on Boeing Aetna Medicare Advantage C. I pay both Medicare A and B as well as D, or in other words, is C in, if I have an Advantage plan, do I need a D plan? In other words, a Medicare prescription drug plan, or is that dovetailed into the C?
Yeah, that's a great question. So with the MAPDP plans, there's always prescription drug coverage. And that is what Boeing offers. There are out there things called MA only plans, meaning Medicare Advantage without a drug coverage. There's not many of them, and they're very rarely used. They actually work really great for veterans who use the VA and receive medications from the VA. Well, if they're receiving their medications, they don't need Part D, so we can get them onto what they call an MA only plan. But plans like Boeing's plan, and with the bulk and majority of the Medicare Advantage plans that I help people with, are going to have that prescription drug benefit built into it. It's one plan with the drug coverage added.
Great. And so Tricia also follows up with the question then, if that's covered, if I have already coverage through my Advantage plan, is there any reason to get a Part D RX plan?
No, in fact, that would be really bad. So anytime you sign up for an Advantage or a prescription drug plan, it will wipe out what your previous coverage was.
Oh.
All right. So, and I've had people do this. They thought that, oh, I can buy an MA only and then separately buy a prescription drug plan. What happened is they signed up for this great Medicare Advantage plan, and then they went and signed up for the drug coverage. And when they signed up for the drug coverage, the MA went away, and all they had for the whole year was a drug plan with Medicare A and B. not ideal, but it may not be the end of the world as long as their health is relatively good that year. But yeah, you gotta be careful. And that's the thing, is it doesn't hurt to ever reach out to someone like myself and just get some answers. There's also what they call Sheba, which is the state resource for Medicare information. So, if you don't feel like you want to talk to an agent, you can talk to these Sheba representatives that work for the state, and of course, should be giving you unbiased information as well.
Another couple questions here, Tim. Jim asked, they're currently covered by the Boeing Aetna Advantage plan. They don't have dental coverage, of course. So do you have any suggestions for that type of coverage, or is that something they should look at, or just self-insure?
It's a great question, but everyone's going to be different there. The first thing I always ask people to do is, talk to your dentist, talk to the office and say, here I am in a situation where I don't have dental coverage anymore. I used to have it from the employer. What do you recommend I do? And they have lots of different programs. So some dentists actually have a contract that you can sign where you pay them $25-30 a month, and they'll cover all of your preventative care and then give you a discount on more comprehensive services like crowns and implants and things like that. Some may say, well, don't get a plan at all, just pay cash, and then, I guess that depends too on how much dental care you're needing each year. Pretty much if a person's just going in for their cleanings and their x-rays and exam, it might be best to self-insure, because you could be paying more premiums than what you're getting in value each year. And that wouldn't be a good thing. And then sometimes the dentist will recommend a certain dental plan. So I always say start there, but then also kind of do the research. Think about it. People will ask about dental and eye care as well. And it's like, well, are you paying more premiums than you're getting back in value? And that's something that you got to look at. It's, when you were working for an employer who paid 80% of the cost of the premiums, of course you had the dental plan or the vision plan, but when it comes down to you paying the full bulk of it, you really got to determine whether that insurance makes sense.
Great. Couple few have come in here late here, but Steve asks, he's covered by his wife's. Let me read this here. My wife and I are retired, signed up for Medicare several years ago. We have coverage through Aetna, separate from the Boeing plan. We travel internationally each year to visit family. Do you have a recommendation for plans that offer international coverage?
Yeah, so both, well, I guess there's not all supplements do this, but some supplements will offer up to $50,000 of emergency coverage, covered at 80% when you're in a foreign country. And that's for usually the first 60 days of being in a foreign country. Medicare Advantage plans, all of them will provide worldwide emergency and urgent care coverage. So you do have that as a little backup. But I always recommend, whether it's my parents I'm talking to or people, if you travel internationally, it really is a good idea to get travel insurance that not so much just to cover if you have to cancel your trip, but what if you need emergency airlift home, alive or dead, unfortunately, but those things can be very expensive. It could be $30,000 to $60,000 to get you home in a medical transport situation. So that, or if you had to have more involved surgeries, you weren't able to move, you needed to receive those surgeries in that foreign country. A good travel policy should help you with that.
Great. Couple more here late. Philip asks, I'm covered on my wife's state employee plan, and he's on the East Coast half of the year and then the West Coast the other half of the year. Question is, should he drop his Advantage plan and go with traditional Medicare, back to traditional Medicare supplemental options?
If you have access to those employer plans, oftentimes they have multiple options, not Boeing, sorry, but with the state employees, they do have multiple options, and you should look into what those things are. For instance, well, with Boeing's plan, I know that they pretty much charge the same amount whether you're using an in or out of network doctor, and then they set a limit on what your total out of pocket expenses are for the year. So it really doesn't matter if you're going in or out of network, or you're using the policy in, you know, East Coast or West Coast or anything like that. You're going to have really good protection on that. But yeah, before considering leaving an employer plan, make sure you understand what you're doing, because I've not heard of a situation where you can leave that employer plan and then at a later date come back to it. Usually when you make that choice to leave, you're not going to go back.
Yeah. One last question under the wire here. Mike asks, I'm self-employed. I expect to continue my business. I'm just turning 65 now. I have a bronze level Kaiser plan through the Affordable Care Act. Do I contact Kaiser expecting a Advantage option, or is there any reason to change if he's still self-employed now that he's 65, or should he go on to Medicare or an Advantage plan or traditional Medicare?
Yeah, so the Affordable Care Act is just, it could be very expensive for someone who's age 65 or older, and also approaching 65. People do know that it can be quite expensive. So it'd probably be in his best interest to get on to Medicare. And of course, you don't want to suffer late enrollment penalties because you didn't sign up when you were first eligible. So definitely sign up for Medicare. Contact Kaiser, ask them what those Medicare options are. In that case, you should probably be ending your Affordable Care Act plan at the month prior to your eligibility month for Medicare, and then having that other Kaiser plan start. Also, if you're not wanting to use Kaiser, that's another opportunity to look at other options and see if there's other doctors that you may want to use. So a lot of different reasons why people chose the plan that they did under the Affordable Care Act, and it may not be something that they want to continue into Medicare.
Great. And then last question here for you is that pre-existing conditions, is that a worry when you go on to Medicare or change plans? Is there a situation there that you should be aware of or cautious of?
It's like a reset button. It is pretty neat, you know, so regardless of what you had before, once you turn 65, you really get this brand new ability to jump onto a plan, and really everybody should, should not avoid Medicare. Medicare is, I was going to say a gift. It's not a gift. We paid for it. We're still paid for it our whole lives, right? So when we get that, it's almost like going from your employer plan to the government plan, both highly subsidized, so that your costs are very low. Now, it's not free. We don't get 100% coverage when we go on Medicare. A lot of people think that happens, but yeah, we pay a small Part B premium, and we got roughly 80% coverage there. So, you know, just Medicare on its own is really good coverage, and that everyone should be taking advantage of that when eligible, either 65 or when they retire.
Great. Awesome, Tim. Great information. Thank you so much. I know it's a busy time for you during open enrollment, of course. So want to thank you so much for taking time out of your busy schedule to spend with us and to enlighten us and shed some information that I think will be helpful for everybody. So thank you so much. I appreciate you being available. Really do.
Thank you for having me.
Yeah, you bet. So excellent. Well, I'm going to wrap this up. We're a little bit over, so apologize for 3 or 4 minutes over, but I want to introduce to our next event, and this is an exciting event. We did an event down in for our Arizona clients. We've got a big contingent of clients. Obviously, our biggest is here in Washington, but we've got clients in 30 different states. Our biggest contingent outside of the state of Washington is in Arizona. We did an event down in 2018, really well attended, and we were planning on going back, but then COVID came and disrupted that. So we're actually coming back to the Phoenix area for a live event, which is our next scheduled event in February 19th and it should be just a great economic event. So one thing is obviously our folks down in Arizona would love for you to attend, but also we're going to open the invitation up to everybody here in the state of Washington. So if you want an excuse to get to the desert, get some sun, please join us for that event, which we'll be sending out invitations as we get closer to that. So thank you everybody again for your time. Appreciate it. If there's any other questions or if we can be of service to you, as you know, we're always available. Our whole team is at your disposal, and look forward to talking to you again and putting on these events throughout the rest of next year. Take care. Thank you so much. Bye-bye.